Good morning and good afternoon to journalists and other across the region joining us on the World Health Day. World Health Day is WHO's birthday. We usually mark it by celebrating progress towards better health, but 2021 is different. We're now in the second year of once-in-a-century pandemic, which is testing our ability to ensure the highest standard of health for all. The theme of this year's World Health Day is Building a Fairer, Healthier World. And it calls on us to pay greater attention to addressing inequities. The pre-COVID world was already an equal one. Unfortunately, the pandemic has amplified many existing inequities and even created new ones. All of us have been affected by COVID-19, but some have been hit harder than others. When this virus enters vulnerable communities, they suffer more. For instance, foreign workers in some countries, people in informal urban settlement, and migrant communities can face more difficulties with living conditions and access to healthcare. There is an important principle at stake here. Your vulnerability to infection and how you fare if you are infected should not depend on your passport or your paycheck. We should all care about this, and not just because it's what's right, also because if the virus is allowed to run rampant among vulnerable groups, it affects whole societies. When infections surge and hospitals are overwhelmed, health workers cannot provide care to anyone. And it is not just the virus itself that has had an impact on our societies. The measures put in place to contain the virus have taken a heavy toll as well. Millions of people are now out of work for the first time in 20 years. Global poverty levels are predicted to rise. Across the Asia Pacific, some 5.9 million children are now at risk of never returning to school. And several countries have reported increase in violence against women and children. Extended lockdowns have meant more time at home, but unfortunately, home is not a safe place for everyone. These issues have profound consequences for physical and mental health, impacts which will be felt not only today, but in the years and decades ahead. These issues highlight the fact that our battle against COVID-19 and its impact are far from over. COVID-19 has now resulted almost 2.9 million deaths around the world, including almost 32,000 people in our region. It fills me with great sadness to think of the lives that have been lost, each of which is a loved one whose family and community mourns their loss. Although we have been comparatively fortunate in this region, with just 1.5% of globally recorded cases, as Babatunde presented, now several countries are experiencing surges. WHO is analyzing countries around the world and formulating hypotheses on what is driving these surges. We believe multiple factors are contributing. First, the impact of what we call variants of concern. Some of these variants appear to spread more easily than the original virus, though we still need more information to confirm the impact of this on the ground. The second, the relaxing of some public health measures, such as limit on gathering of people, especially in indoor space. And third, partly as a result of relaxing of these restrictions, increased movement of people in their 20s, 30s, 40s who may have mild or asymptomatic COVID-19, spreading the virus without realizing it. COVID-19 may have limited impact of these people, but it has a potentially devastating impact on more vulnerable people with whom they come into contact. And fourth, vaccine optimism. This is the belief that now the vaccines are starting to roll out. The end of pandemic is near, and we can relax the other measures which reduce transmission. Unfortunately, this is just not the case. We can anticipate that there will be more of these surges. The virus is still circulating, and we simply cannot let down our guard. Not yet. I want to emphasize 5 points in this regard. First, I understand that people are sick of this pandemic. I am too. But despite this fatigue, we must continue with the basic prevention measures such as mask wearing, hand washing, and maintaining a physical distance, at least until the majority of people in every country have been vaccinated. These are still our most important tools for preventing transmission of the virus. Second, the government must continue to ensure a strong system for surveillance and early detection of cases and implement targeted localized response. Targeted response reduces the risk of broader community transmission and minimize economic and social disruption. And third, all countries should be strengthen their healthcare capacity and public health system to prepare for possible large-scale community transmission. As we've seen in recent weeks, the virus situation can change quickly, and our best defense is to be prepared. And fourth, effective use of vaccine. Vaccines offer us all great hope, but for now, they are in relatively short supply. It is vital that these limited doses currently available are given to those who are most at risk of infection, starting with health workers and then other vulnerable groups at the higher risk of severe diseases, such as old people and those with underlying condition. And we must ensure this happens in all countries as quick as possible. And fifth, strengthening surveillance to pick up anything unusual, such as behavior of various virus variants. Good information which help us to understand how the virus is behaving is one of our most important tools. On this note, I'm pleased to share that we are moving towards establishing a genome surveillance network, whole genome surveillance network, to help countries in the Western Pacific region to rapidly share information on variants of concern and support targeted response. To conclude, COVID-19 has shown us that we need to do much more to build fairer and healthier world for the future. We need to work together to end this pandemic, do better at preparing for and responding to future infectious diseases outbreak, and we need to address the underlying inequalities which makes some segment of the population so much more susceptible to serious illness and death. We can't do it on our own. We need everyone to come together. This virus can only survive by passing from person to person. Your action help to protect the vulnerable. We've said from the beginning of this pandemic that no country is safe until every country is safe. But it's also true within countries, no community is safe until every community is safe. That's what World Health Day calls on us to do this year.